Good afternoon. Again, I'm Kelly Essex. I am the social worker for the Atlanta VA Medical Center with the Oncology Department in Radiation Oncology. And I'm pleased to know that there may be 5 other MSWs here somewhere. Anybody else? Hey! Okay, great. So that's more than we had last year. But I have the pleasure today of discussing some of the major psychosocial resources available through national organizations, and we have 3 here. I don't see their faces yet, but when I call their name, I'm sure they will stand up. But I did have a couple of things I wanted to share with you before I call them up to speak and share with us. First, I like sharing this quote with anybody that I come in contact with, especially when I get to have the opportunity to speak in front of large masses of people. It is more important to know what sort of person has a disease than to know what sort of disease a person has. And I think this quote is so powerful to know that when we're treating patients, we are treating the person rather than the disease. So to keep in mind that when we're treating them, treat them as a person, treat them as a human being, and see what we can do best to, make their lives more comfortable. So why is multiple myeloma unique? It's a disease that requires long-term management. There's the potential for ongoing pain and disability, and the focus is on disease control rather than cure, which in turn makes there have this constant balance between psychosocial concerns and goals of therapy. So some of the common psychosocial factors that you all are probably aware of that our patients go through is emotional concerns, some denial, shock, fear, grief, hopelessness, hope sometimes, and even sometimes have determined outlook. Communicating with family and friends regarding the diagnosis can sometimes be a stressor. The disability because of the inability to work, and the cost of ongoing medical care from medications and treatment. And then, of course, with our patients, transportation assistance or funds, lodging costs, and then, of course, the adjustment of new roles and responsibilities. So today we have the pleasure to have 3 different representatives from 3 national organizations. The first one is from the American Cancer Society, Ryan Branch. She is the missions delivery manager. Is she here yet? Hey, Ryan, you can come on up. We'll have Ryan speak first, and then next we'll have from the International Myeloma Foundation, Ms. Nancy Bruno, and then the Leukemia and Lymphoma Society, we have George Harris and Rosalinda. So we'll start with Ryan.
Hi everyone, good afternoon. As Kelly said, I'm from American Cancer Society. I do work at our national home office, which is about 2 blocks that way, so we're very close. I'm just going to very briefly hit on a few resources that some of them you might know about. I kind of tried to pick a few that maybe you might not. One, I'll start with our clinical trial matching service called Trial Match. This service helps patients find high-quality care in clinical trials that best match their medical needs and personal preference, while also helping researchers study more effective treatment for future patients. Information is not biased at all, provided by the American Cancer Society, and our database is updated daily, not only with the information on the new trials, but also the contact information of the doctors and the nurses at the cancer centers for the patients to be able to reach out to them. Through the American Cancer Society matching service, we connect patients with more than 64,000 different options. And if you're curious, if you do have a trial, most likely it is in our database. The FDA now requires that all trials are listed through cancer.gov or clinicaltrials.gov, which automatically feeds into our database. We do have clinical trial specialists available Monday through Friday, and that's via phone. And then cancer.org, there is the trial matching that's available 24/7, and patients can also request that the specialist give them a call back. So also speaking of our call center, our 1-800 number, I hope most of you have heard that, or of that. It's open 24 hours a day, 7 days a week. Anytime a patient calls, someone will answer that. And the number one request we receive is information. It might be cancer site specific, different approved treatments, but that is our one request. And last year we had over 1 million calls to that call center. Our cancer.org website had over 23 million visits last year, so we're proud of that website and lots of wonderful information on there. And so when you call that 1-800 number, you do speak with a cancer specialist, and that cancer specialist has a database that we call our Cancer Resource Connection. And currently, I believe it's right over 70,000 local, national resources. So let's say if a patient is in Ohio and they would like information about the closest multiple myeloma support group. It does not have to be a ACS-specific resource, and we're able to connect that patient with the appropriate organization in their area. So that really is a collaboration of so many different resources. Hope Lodge, we do have one of those in Atlanta, and I'm sure a few of you here. Does anyone know of one in your area? Yes. It's a wonderful, wonderful facility, and if you ever get the chance to go into one, I highly recommend it. It's a beautiful place, and really what it is, it's a home away from home for our cancer patients that are traveling for treatment. So last year we had over 41,000 patients and caregivers stay at a Hope Lodge in the country. We have 31 currently, which provided over 260,000 nights. So that's a wonderful thing that takes off a really big burden of the family. And Road to Recovery, I know, does anyone know of a program, Road to Recovery, in here? It looks a little different in different locations, but what it is that you make a referral to the 1-800 number or a fax referral form, and it's completely volunteer-based, and a volunteer picks up the patient and takes them back and forth to treatment. So we also have Look Good, Feel Better. I'll end on that. It's one of my absolute favorite programs we offer. It's a 10-step program. A cosmetologist comes in, and you learn things that you wouldn't have to know unless you're thrown into the cancer world for these women that are struggling with so many different things. You might learn how to draw your eyebrows on, and they leave with a beautiful makeup kit, and if you have a local office, we're always excited to get that program going in new locations. So if that's something you're interested in, I encourage you to get some more information. We do have one here in Atlanta, and Kelly's kind of the ringleader for it, and it's just a great program. So I think that's about all my time, but thank you so much for having me, and I hope you all have a great weekend.
They'll be available at the end to discuss the resources for anybody who wants to institute the programs that we have in your area. So, stay here.
Okay, next we have Miss Nancy Bruno from the International Myeloma Foundation. Hi, Nancy. And Nancy has an amazing story I read on the website, so if you wanted to share that as well, you can, but not to put you on the spot.
Oh, thanks. I've been around multiple myeloma for 15 years. My husband was diagnosed in 1998. And although he's been gone 2 years, I still am so excited about the good news in myeloma. And I worked with the Atlanta support group, and now I work with the International Myeloma Foundation. And I have 26 support groups throughout the Southeast. But the good news is really, exciting at this day and time. When a myeloma patient gets diagnosed with the incurable rare blood cancer, it's very overwhelming. But for them to be able to sit down and talk to other patients that have been down this journey and see how well they're doing and learn about the chemo, stem cell transplant, and all the tests they're going to have, the bone marrow biopsy and everything, it helps the patient to be their own best advocate, and it actually improves their relationship with the healthcare team. So they've, just got some more familiarity and they're better educated. We have two support groups here in Atlanta, the North Side and the South Side. The South Side group is primarily African American, which is always a challenge to get them into the doctors. The previous speaker was talking about being stoic. I call it the John Wayne syndrome. It's just a flesh wound. It's no big deal. John Wayne, they want to help the women and children and ride off into the sunset. But to be able to talk about what they're facing and to be educated and get over that denial and really be their own best advocate is challenging. I work with the International Myeloma Foundation, which was founded in 1990. They have the International Myeloma Working Group, which educates oncologists throughout the world. The Nurse Leadership Board, which is 20 members, nurses from Centers of Excellence in Myeloma, and they write the textbook on myeloma for nurses and guidelines for managing the side effects. The International Working Group writes diagnostic tools, and they conduct workshops for physicians and the consensus guidelines for treatment. We have newsletters. Our website is myeloma.org. You can go there and learn about education, research, advocacy to get drug parity for the oral drugs. And we also have a hotline that helps with understanding the diagnosis, the treatment, the side effects, transplants, assessing the response, resources. We have 140 support groups that we promote throughout the U.S., and we have some around the world too, in Australia and Europe and South America. And those support groups bring people together to share experiences, and you can talk to people that have been down the road, and it's very, very empowering. Our hotline is 1-800-452-CURE, the website, myeloma.org, and I recommend you check it out for resources for myeloma patients. Thank you.
Nancy, come back and sit on the panel. Thanks. Okay. And then last but not least, we have from the Leukemia and Lymphoma Society, Mr. George Harris, who is a VIP, which is a volunteer involvement program. He's also one of our very own nation's veterans and an NHL survivor. Thank you.
Good afternoon. I'm glad to be here for a number of reasons. One, to speak as a survivor and then also as a veteran. Just a quick story about me. I was diagnosed with stage 4 non-Hodgkin's lymphoma in 2007 while stationed right here at Fort McPherson. And I was an infantry officer, so it caught me quite a surprise because it was something that, rough and tumble infantry officers are not supposed to get sick. Well, it took me for a loop. Yeah, the John Wayne syndrome. Yes, you're exactly right. So I was medically retired about 5 years ago, and one of my greatest concerns was what's going to happen after I transition from active duty to the civilian world. Do I still see my oncologist at Emory, or am I going to have to go to the VA and see an oncologist there? And there were a lot of questions that were not well with me, and felt very uncomfortable about what I was stepping off into, just being really a year out of remission, and really concerned about whether or not 6 months I'm going to relapse, and then what? So there were a lot of concerns for me as a veteran and as a patient. And my goal is to help educate you all about the resources with the Leukemia and Lymphoma Society, and then information you can pass on to other veterans, as well as yourself. And interestingly enough, as we talk about multiple myeloma, I'm actually friends with several multiple myeloma patients. One is a young lady by the name of Jamaica Barrett, who is the youngest multiple myeloma patient diagnosed here in the state of Georgia. She was diagnosed at 26. And we're good friends now. And then I'm also friends with an Air Force veteran who is a multiple myeloma patient as well. So we have a lot in common dealing with as fellow veterans and then as cancer survivors. So just quickly about the Leukemia and Lymphoma Society. They have I'm going to focus on what they call patient services, which is what I'm part of as a VIP. The patient services program is specifically designed to help patients who are in treatment or in remission with regards to any issues they may have, whether it's financial, with support groups, so on and so forth. So quickly, I'll talk about what my experience has been and then what resources are out there. So one of the first things I want to talk about is it's called the First Connection Program. And the First Connection Program is kind of like a peer mentoring program for cancer patients. So I've done a number of First Connections with civilians as well as those that are veterans. I've run into many veterans who are dealing with blood cancers right now, and they have a lot of concerns about the treatment that they're getting, what resources are out there, and in many cases they don't really know where to go. And so in many cases I'll spend at least 2 hours on the phone with someone who's trying to figure out exactly what's out there for them, whether it's some type of program for copay assistance or what treatments are out there for someone with a specific type of cancer. And as I talk about something called copay assistance, there is a program under LLS called copay assistance. So this copay assistance program is for those who may be experiencing some type of financial hardship and they can't afford the copays either for a drug or some type of inpatient treatment. There's a program to help anyone who basically submits an application. This program is also designed to help those pay their premiums on their insurance as well for COBRA. The other thing is LLS will help anyone who is a patient enter into any clinical trials. There was actually a story, I was up in Washington, D.C. as part of an advocacy group with a couple of health-related bills. A young lady who was literally on her last leg, and there were no other treatment options for her, and LLS helped this young lady get the last reasonable treatment that was available for her, and it went all the way up to the headquarters up in New York. And this young lady got the treatment that she needed, and she's a survivor today because of the support she got from LLS. The other thing I wanted to talk about were support groups. There are a number of support groups here in Atlanta and across the country, and one of the great things about LLS is it's very entrepreneurial. If you find an opportunity to create a support group, you can do that. So just as we were talking about the Multiple Myeloma Foundation and their support groups, here in Atlanta, there are support groups that focus on the Hispanic speaking population. There are support groups for African Americans. There are support groups for young patients. There are support groups for older patients. And so any opportunity you can find to reach out and support someone, you have that opportunity. The last piece is under advocacy. So as I spoke before, I was recently in Washington, D.C., meeting with the senators and congressional members from the state of Georgia, talking about specific health care access bills that would help make it affordable and available for anyone who needed specific treatments under the Tier 1 treatments. So there's a great deal of advocacy that goes along with LLS to make sure that, like I say, anyone who needs treatment has access to it. So if you've never been to the website before, the Leukemia Lymphomas website is lls.org, and there's a great deal of information there. There's also a 1-800 number, a hotline there in case someone needs some assistance. Again, I don't have that number with me right now, but if you go there under Contact Us, that number will come up. And then, like I say, you can also put in the zip code if someone needs to find a specific chapter somewhere. I think all 50 states have chapters. And thank you for having me here. I'm glad to be able to spread the information and look forward to talking to you all.